I'm Princess Melanie Sumarilang. I am here today to administer Intradermal. So first, we need to gather all the materials needed. Check the medication order against the original physician's order according to agency protocol. Clarify any inconsistencies and check the patient chart for allergies. So, then note the actions or special nursing considerations. Save those ranges, purpose of administration and adverse effect of the medication to be administered. Consider the appropriateness of the medication for the patients. And perform hand hygiene. And move the medication cart to the outside of the patient's room or prepare for administration in the medication area. And then prepare medications for one patient at a time. Read the medication administration record or the MAR and select the proper medication from the patient's medication drawer or unit of stock. And compare the label with the MAR. Check the expiration date and perform calculations if necessary. Compare the MAR to the medication. And then next, if necessary, withdraw the medication from ampule or vial as described in the previous skills. And then next, when all the medications for one patient have been prepared, recheck the label with the MAR before taking them to the patients and lock the medication cart before leaving it. And transfer the medication to the patient's bedside and carefully and always keep the medication inside. And then ensure that the patients receive the medication at the correct time. And then next is we need to identify the patients. Usually, the patient should be identified through checking the name and identification number on the patient's identification band. And second is ask the patient to state or her name, his or her name. And then if the patient cannot identify him or herself, verify the patient's identification with a staff member who knows the patients for the second source. And then next is close the door to the room or pull the bedside curtain. Complete necessary assessments before administering medication. Check the allergy bracelet or ask patients about the allergies or explain the purpose of medication to the patients. And perform hand hygiene and put on gloves. And then next, select the appropriate administration site and then assist the patient to the appropriate position for the site chosen and drape as needed to expose only the area to be used. And then next is cleanse the sites with the antibacterial swab while wiping with a film in a circular motion and moving outward in the injection site. And then allow the skin to dry. And then remove the needle cap with a non-dominant hand by pulling it straight off. And then use the non-dominant hand to spread the synthode over the injection site. And then hold the syringe in the dominant hand between the thumb and forefinger with the bevel of the needle up. Bevel and the needle up. Hold the syringe at the 10 to 15 degree angle from the site and place the needle almost flat against the skin of the patient and bevel side up. And insert the needle into the skin so that the point of the needle can be seen through the skin. Insert the needle only about 1/8 with enter bevel under the skin. And then once the needle is in place, steady the lower end of the syringe. Slide your dominant hand to the edge of the plunger. And then withdraw the needle quickly at the same angle and it was inserted. And then do not massage area after removing the needle. Tell the patient not to rub or scratch the site. If necessary, gently blot the site with a dry gauze square. Do not apply pressure or rub in the site. And then do not recap the used needle. Used needle, engage the safety shield or the needle guard if present, and discard the needle and syringe in the appropriate receptacle. And assist the patient to a position of comfort. And remove the gloves and dispose of them properly and perform hand hygiene. And observe the area of reactions at the determined intervals after administration. Inform the patients of the need for inspection and document the procedure to the patient chart. Thank you.